the White House will be providing some guideposts and guidelines about what we think we can afford to do, how we think it's best to do it, but we don't have a monopoly on good ideas, and to the extent that this work is being done effectively in these various committees, then I assure you that we are going to do everything that we can to work with all of you, Democrat and Republican.
I appreciate the fact that we held this hearing and that we're beginning the bipartisan process, and I look forward to working with you throughout.
The biggest problem we have long-term is Medicare and Medicaid, but whatever reforms we initiate on that front, and we're very serious about working on a bipartisan basis to reduce those deficits or reduce those costs.
Congressman, I would say that the administration is committed to working with Congress and has every hope that this will be a bipartisan effort, and hopes that all serious ideas are on the table from both sides of the aisle.
We recognize that there remain looming challenges to our fiscal health beyond that. Challenges that will require us to make health care more affordable and to work on a bipartisan basis. I think it's very important to understand that since I came into office, I have said to my Republican friends in Congress, I want to work with you.
Yesterday, let me talk about the meeting with the President yesterday. Yesterday, the meeting, the President asked the members of both committees to come to the White House. We had about an hour and a half, very substantive meeting where he asked he talked for 5 minutes, then he answered and answered questions and commented on our comments of the 20 or so senators there in the two committees. There was overwhelming sentiment, a strong message. His public support for the public option, we knew from the campaign. He reiterated that. The President, the President was very definitive yesterday, as Democratic leaders in the House and Senate are, that this bill is going to happen this year. We're beginning the walk through the bill this week. We started yesterday on the prevention side of the bill. We're going to talk about access and quality issues today and tomorrow. We're going to walk, the Democrats are walking through the bill and doing some rewrites before the first initial introduction is finalized, if you will. In the next couple of weeks, 2 weeks from now, we're likely to do the markup of the bill. Probably will take a full week, maybe longer in both committees. We'll pull them together. The President wants this legislation on the floor and passed by the end of July, the 1st of August, before the August recess. He said to us he wants to sign the bill in October.
All across America, people are hungry to get out of the old divisive politics of the past. Let's have an honest debate. We can agree on that.